Hello and welcome to the 10th Global Conference on Health Promotion. Over the next 3 days, we're going to be hearing from all corners of the globe, from all partners with a vested interest in well-being, in equity, and in sustainable development. My name's Hannah Vaughan-Jones. I'm a British journalist, and I'm so proud to be working with WHO and such a dedicated team of professionals who have poured so much time, energy, and expertise in convening this conference, of course, in the middle of a global pandemic. Now, over the next 72 hours, we will build towards the Geneva Charter for Wellbeing with 7 plenary sessions, a health promotion forum, which has already begun, and numerous deep dive sessions, all aimed at sharing knowledge, perspective, experience in the spirit of respectful collaboration. Now, this is a conference, and I can't stress this enough, this is a conference for everyone joining us on this virtual platform, for the audience, all 4,000 plus of you, and counting, as much as it is for the speakers. So, that's what you can expect over the course of the next couple of days, but let's look now at what the future generation expects of us.
It's taken a pandemic to help us realize just how sick our world has become. We've been slaves to materialism, building our personal empires and countries' economies. We convinced ourselves that life was great. We were connected to everyone, and yet no one. We ignored the cost to ourselves, other people, and our planet. When COVID-19 arrived, it forced us to stop. We had time to question our way of life. If we had done things differently, could we have been better prepared? As people lost their jobs, their health, their loved ones, as children learned differently or stopped learning altogether, as those who were already suffering suffered more. We've realized we can't go on as before. How can we say our economies are thriving when the cost to our societies is so high? There is a way out of this, and we all have a part to play. Countries should be measuring their success by the well-being of their people and the environment they live in, not just by deals and trade or profits made on products that are threatening our world and our own survival. We need to stop pursuing the same old self-destructive priorities and create conditions for people to live better lives. Health should be factored into everything, both globally and locally, because we all need healthy environments in which to live, learn, work, and play. Some countries are already getting this right. Bhutan has a gross national happiness index, where indicators such as living standards, community vitality, and psychological well-being drive a more meaningful and sustainable way of life. New Zealand has a well-being budget, which uses human health, safety, and flourishing to assess the success of its policies. The UAE's happiness agenda ensures the government prioritizes happiness across all its policies, while Finland and other Nordic countries have adopted a health in all policies approach, growing the well-being of their people. Other countries are also finding new ways to move forward. But more of us need to come together and hold each other accountable for taking the incredible amount of information we have to promote better living and turning it into real action to transform our lives. COVID-19 has cost the world dearly, but it's also given us a chance to change the path that we're on and create the future we want.
Well, as you can see there, high hopes, huge challenges as well. But let me introduce you to Dr. Tedros, who joins me now, of course, the Director General of the World Health Organization. Tedros, you must have high hopes as well as seeing the challenges that lie ahead.
Sure.
And I believe you have some opening remarks you'd like to formally open this, this conference for us, so I hand over to you.
Thank you, Hannah. Excellencies, distinguished participants, dear colleagues and friends. It's such a great pleasure for me to welcome you to the 10th Global Conference on Health Promotion. Today, we also celebrate the 35th anniversary of the Ottawa Charter of Health Promotion and the 10th anniversary of the Political Declaration on the Social Determinants of Health adopted in Rio de Janeiro. The theme of this year's conference is well-being, equity, and sustainable development. The Constitution of WHO, written more than 70 years ago in the aftermath of the Second World War, famously affirms that health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. What does that mean? It means that health does not begin in a hospital or clinic. It begins in our homes and communities, with the food we eat and the water we drink, the air we breathe, in our schools and our workplaces. Since then, that affirmation has been reinforced by the commitment to health for all at the Almaty Conference of 1978, the Astana Declaration in 2018, and most recently by the high-level political declaration on universal health coverage made at the UN General Assembly just 2 years ago. And of course, the Sustainable Development Goals adopted by the nations of the world in 2015 offer a sweeping vision for people, planet, prosperity, peace, and partnership. And while the 17 global goals themselves are separate, they're integrated and indivisible. While the world has made progress towards these lofty goals, it's not nearly sufficient. There remain unacceptable gaps within and between countries. The COVID-19 pandemic has exposed these inequities. Over the last 2 years, the COVID-19 pandemic has touched all of our lives, disrupting societies and economies, lives and livelihoods. Many people may feel that they are no longer in control of their health and that they face an increasingly uncertain future. Beyond the terrible impact of COVID-19 itself, the pandemic has led to disruptions in essential health services that has hindered efforts to tackle many other diseases and conditions, from malaria to maternal health, from rare diseases to diabetes, non-communicable diseases, and mental disorders. Existing inequities and inequalities have been exacerbated, with millions more thrown into poverty, many months of education lost, and uncounted increases in physical and emotional stress. The pandemic has shown that when health is at risk, everything is at risk. But the opposite is also true. When health is protected and promoted, individuals, families, communities, economies, and nations can thrive. That's why health must not be seen as a cost, but as an investment in productive, resilient, and inclusive societies. Achieving health for all demands that we reach beyond the health sector. It demands an all-of-government, all-of-society approach, including economics and finance, infrastructure and housing, transportation, energy, and environment. We have to fundamentally change the way that leaders in politics, the private sector, and international institutions think about and value health, and to promote growth that's based on health and well-being for people and the planet, for countries in all income levels. It's time to move away from thinking of health as a component of the economy and instead look at how the economy can support the societal goal of health for all as an investment that's the foundation of productive, resilient, and inclusive economies. Vaccines will help to end the pandemic, but they will not address the vulnerabilities that lie at its root. Once the pandemic ends, we will be left with even greater challenges than before it started. Poverty, hunger, inequality, non-communicable diseases, climate change, and more. We must not go back to the same exploitative patterns of production and consumption, the same disregard for the planet that sustained all life, the same cycle of panic and neglect, and the same divisive politics that fueled this pandemic. The pandemic has brought us to a fork in the road. Behind us lies the path of business as usual, the path that led us to this crisis. Before us lies a new path, the path that leads to healthier, more resilient, and more sustainable societies. This conference is an opportunity to progress down that path, an opportunity for meaningful dialogue, sharing experiences, and concrete recommendations on how to best advance well-being. The Geneva Charter for Well-being outlines goals for achieving equitable health and social outcomes now and for future generations within ecological limits. As you move forward, let me leave you with 3 priorities. First, remember that health is part of a larger ecosystem that encompasses environmental, social, economic, and political factors. Second, at the core of all of our efforts must be universal health coverage based on strong primary health care, which is the cornerstone of social, economic, and political stability. And third, let's rethink the narrative around health, not as a cost, but as an investment in our common future. I thank you, and I wish us a productive conference. And Hannah, back to you.
Tedros, thank you so much. A really impassioned plea there for a holistic approach to health and well-being overall, something that we will be hoping to, of course, convince everyone else of who's as yet to be convinced over the course of this conference. But we want to hear from you as well and what you think as we kick things off. Do you think it's realistic to create well-being societies, or is this just wishful thinking? That's the question we're asking in the poll, and on the virtual platform you'll be able to give your answers to that. So I repeat the question: do you think it's realistic to create well-being societies, or is this just wishful thinking? The results of that question, that poll, will be revealed in the next hour or so during the first plenary. I'd now like to introduce some very important global leaders to also address the start of this conference. And first up, we have the honor of hearing from His Excellency Carlos Alvarado Quesada, President of Costa Rica.
Excelencias, señor Director General, estimado Dr. Tedros, mi hermano. Muchas gracias por invitar a Costa Rica a ser parte de esta conferencia mundial sobre promoción de la salud. El sistema de salud de mi país da enorme importancia a la promoción del más alto estándar de salud física, mental y reproductiva para toda nuestra población. Así, más allá de asegurar el tratamiento y la prevención de enfermedades. Para atender los determinantes sociales de la salud, debemos también garantizar el acceso y el fortalecimiento de los sistemas de protección social, que generan las condiciones mínimas para discutir e implementar las políticas de promoción de la salud. El sistema de seguridad social y el Sistema Universal de Cobertura de la Salud en Costa Rica son dos caras de una misma moneda y la piedra angular del desarrollo social de mi país. El éxito de nuestro sistema obedece a esfuerzos integrales emprendidos desde hace décadas y adaptados con el tiempo. Desde los años 70, el país emprendió programas de nutrición, campañas de saneamiento y vacunación, una red de atención para niños y niñas y se invirtió en educación. La pandemia, que ha golpeado con mayor dureza a los sectores más vulnerables, es el más crudo recordatorio de la necesidad de trabajar conjuntamente como comunidad internacional para fortalecer la promoción de la salud y afrontar los desafíos resultantes de sistemas de salud menguados de recursos humanos, técnicos y principalmente financieros. Solo aumentando la inversión en salud pública a nivel global podremos resistir los embates de las crisis sanitarias. Nadie estará a salvo hasta que todas las personas estén a salvo. Los derechos humanos y los ODS son nuestra guía para avanzar. La solidaridad y la colaboración entre todos los actores, gobiernos, sector privado, sociedad civil, academia, organismos internacionales, son fundamentales. La salud es un bien público y un derecho fundamental. Estamos llamados a promoverla y a protegerla con firmeza. La humanidad no puede permitirse nunca que la avaricia y el lucro restrinjan el acceso equitativo a los tratamientos o diagnósticos, la transferencia de tecnologías, las vacunas o cualquier otra medida relacionada al mejoramiento de las condiciones de salud. En este contexto, quiero agradecer el apoyo de la OMS y los países parte del acceso mancomunado a la tecnología. El CETAP es una herramienta que busca contribuir el intercambio abierto de los conocimientos, propiedad intelectual y datos para hacer frente a las enfermedades y amenazas a la salud a nivel global. El CETAP debe crecer y fortalecerse como un mecanismo solidario que al compartir innovaciones e información pueda promover la salud en el sentido más amplio. Tenemos que ir más allá. Señor Director General, Costa Rica reconoce la necesidad de contar con un instrumento jurídicamente vinculante que fortalezca nuestras respuestas globales sanitarias ante pandemias, para que en unidad acordemos las mejores soluciones a las enormes brechas que evidenció la COVID-19. Necesitamos aprender de nuestros errores y recuperar las soluciones centradas en las personas, que son las únicas que pueden acercarnos a los cambios transformadores que requerimos. Debemos regresar a los derechos humanos, a la equidad y a la solidaridad para promover la salud sin dejar a nadie atrás. Costa Rica se une a la celebración de la 10ª conferencia y les deseamos una excelente jornada.
Excellency, thank you very much indeed. We turn now to His Excellency Alfredo Borrero, Vice President of the Republic of Ecuador.
Señor Director General, altas autoridades presentes en esta conferencia, distinguidos participantes. El Ecuador valora en alto grado los esfuerzos desarrollados por la Organización Mundial de la Salud, así como de todos los Estados miembros y de todas las entidades que han apoyado la realización de esta 10ª Conferencia Mundial de Promoción de la Salud, cuyo enfoque amplio y comprensivo del bienestar, junto con la acción protagónica y participativa de los ciudadanos, resulta crucial para permitir a nuestras sociedades alcanzar la prosperidad. El Ecuador ha apoyado e impulsado los empeños globales en este ámbito y tiene plena conciencia de que las condiciones políticas, sociales, económicas y ambientales tienen una incidencia directa en la salud, el bienestar y la prosperidad de las naciones. En este sentido, es evidente la afectación que ha tenido la pandemia sobre los esfuerzos nacionales por alcanzar el desarrollo sostenible en todos los países, exacerbando los desafíos existentes, retrocediendo en la implementación de varios objetivos de desarrollo sostenible y creando nuevas vulnerabilidades. En el caso del Ecuador, tras el proceso de evaluación de los impactos de la emergencia sanitaria por la pandemia del COVID-19, se estima que las pérdidas han superado los 6.400 millones de dólares únicamente en el campo económico. A partir de mayo del 2021, el nuevo gobierno del Ecuador enfrentó con decisión el reto de revertir los dramáticos indicadores que nos habían colocado como uno de los países más afectados por la pandemia en la región y en el mundo. Entre las acciones prioritarias, y a pesar de la falta de cifras reales acerca de la población inmunizada o de las vacunas disponibles, emprendimos un plan masivo de vacunación que logró en apenas 100 días revertir la situación crítica que vivía la población y superar la meta de inmunizar en 100 días al 50% de la población ecuatoriana y extranjera que reside en el Ecuador. Por otra parte, más allá de la situación de vacunación, la pandemia también puso de manifiesto la situación endeble de los sistemas de salud de gran parte de los países, así como sus consecuencias en el ámbito sanitario y en el desarrollo social. Se han evidenciado deficiencias relacionadas con un amplio espectro de temas que van desde problemas estructurales, limitaciones en los servicios de salud, lentitud en la toma de decisiones, distribución inadecuada de los recursos, desabastecimiento de vacunas, medicamentos, insumos, hasta la corrupción. Sistemas de salud en esas condiciones no pueden hacer frente a las situaciones cotidianas, menos aún a un embate de la magnitud que ha tenido la pandemia. Conscientes de la gravedad del asunto, el gobierno del Ecuador adoptó un plan para transformar el sistema de salud de un modelo curativo a un modelo preventivo que involucra a todos los actores sociales, con 3 ejes: salud, salubridad y vida saludable. Desde la prevención se propone construir un sistema de salud eficiente, universal, de calidad y transparente, centrado en las personas, especialmente las más vulnerables. Este diseño nos ha permitido enfocar nuestra atención en graves problemas endémicos, incluidos los determinantes sociales, económicos y ambientales de la salud, y tomar medidas inmediatas para atenderlos. Estamos impulsando la lucha contra la desnutrición crónica infantil, la promoción de hábitos de vida saludables, el mejoramiento de la infraestructura pública para la salubridad, que implica agua potable, saneamiento y manejo de desechos. Hay muchas lecciones que nos dejan estos tiempos desafiantes que hemos debido enfrentar a nivel global. Entre ellas están la recuperación de los sanos principios de la política internacional, la solidaridad, la cooperación, la orientación de los objetivos hacia el bien común. Esperamos poder superar juntos el desafío actual y atender los retos futuros para asegurar a través de la promoción de la salud las condiciones de vida adecuadas que permitan alcanzar el bienestar y la prosperidad a los ciudadanos de todos los países del mundo. Muchas gracias.
Mr. Vice President, thank you very much indeed. Now join me please in welcoming Her Excellency Sun Chunlan, Vice Premier of the People's Republic of China.
尊敬的谭德赛总干事、女士们、先生们、朋友们，在全球新冠肺炎疫情严峻复杂的形势下，第10届全球健康促进大会的召开具有特殊重要的意义。我代表中国政府向大会表示热烈的祝贺，向与会的各位朋友致以诚挚的问候。借此机会，我简要介绍一下中国的卫生健康工作。健康是社会文明进步的基础。中国共产党成立100年来，始终坚持人民至上、生命至上， 经过持续不懈的努力，我们构建了城乡3级医疗卫生服务体系，建立了14亿多人全覆盖的基本医保网，全面实施健康中国战略，坚持大卫生、大健康理念，推动卫生健康发展从以治病为中心转变为以人民健康为中心。国家组织药品和耗材集中采购，大幅降低了基本用药价格，建设国家医学中心和区域医疗中心，推动优质医疗资源扩容下沉，解决看病难、看病贵的问题，使医改成果惠及更多人民群众，保障了全世界1/6人口的健康安全。面对突如其来的新冠肺炎疫情，在习近平主席亲自指挥部署下，我们秉持科学规律，实施动态清零防控策略措施。截至目前，累计感染仅8万多人，病亡4000多人，以相对小的总成本取得最大的防控成效，人均预期寿命从2019年的77.3岁提高到目前的77.93岁。疾病没有国界，应对疾病威胁是各国面临的共同挑战。在新冠肺炎疫情防控中，中国政府积极推动国际抗疫合作，始终本着公开、透明、负责任的态度，及时向世卫组织及相关国家通报疫情信息，第一时间发布病毒基因序列，毫无保留地同各方分享防控和救治经验，尽己所能为有需要国家提供帮助，先后向34个国家派出37支医疗专家组，向20多个国家和地区赠送中医药产品，对外提供了数以亿计的防护物质和检测试剂。中国是向世界提供疫苗最多的国家，已经向120多个国家和国际组织提供超过18.5亿剂疫苗。不久前，习近平主席宣布再向非洲提供10亿剂，向东盟国家捐赠1.5亿剂疫苗，以实际行动推动构建人类卫生健康共同体。我们坚信，只要各国同舟共济、守望相助，就一定能够战胜各类疫情，增进人民健康福祉。这次全球健康促进大会以福祉、公平和可持续发展为主题，体现了国际社会团结抗疫、落实联合国2030年可持续发展意识的坚定决心。中国是全球可持续发展的忠实践行者，支持世卫组织继续搭建健康促进的合作平台，加强政策对话和交流互鉴，促进全球健康公平可及。中国支持全球公共卫生治理，加大对发展中国家，特别是非洲国家公共卫生体系支持力度，提升重大突发疫情应急处置能力，共同构筑国际公共卫生安全防线。
public health
中国
security.
支持践行多边主
China
义，愿与
upholds
各国一道
multilateralism
坚持
and stands
客
ready
观、
to work
公
with
正、
all
科
countries
学、
to
专业的原
enhance
则，
cooperation
深化卫生
exchanges
健
on
康领
health
域
in the
合作
spirit of
与交流。
objectiveness, fairness,
女
science,
士们、
and
先生们、
professionalism.
朋友们，
Ladies, gentlemen, and
健
friends,
康是人类的
health
永
is the
恒追求，
eternal pursuit of
健康促
mankind,
进
and
是
health
国际社会的
promotion
共
is
同
the
责任。
common
让
responsibility
我
of the
们
international
携起手
community.
来，为建
Let's
立一个
join hands
更加
and
美好的
work
健康世
together
界，
for
而
a better
不懈努
and
力。
healthier world.
祝本届大会
I
取得
wish
圆
this
满成功。
conference
谢谢大家。
success. Thank you.
Thank you very much. We now turn to His Excellency, the Prime Minister of the Kingdom of Bhutan. The address itself will be delivered by Her Excellency Dasho Deshen Wangmo, Health Minister of the Kingdom of Bhutan. Let's just see if we can get the audio on this one. Okay, then we'll start again. Apologies. If you wouldn't mind starting again, we'd appreciate it. We're hearing now from Her Excellency Dasho Deshen Wangmo, Health Minister of the Kingdom of Bhutan. Over to you. If you can hear me clearly, then we would appreciate it if you could just unmute yourself so that your volume is up, because we can't hear anything at the moment. So thank you very much for putting your volume up, and I'd be grateful if you could start your address again. I'm afraid we still can't hear you at the moment. Perhaps we can move on to our next speaker then. If I can just have confirmation from the team that the speaker from UAE is ready to go for the next speaker, and hopefully we can reconnect with Bhutan. But we cross hopefully then to the United Arab Emirates and His Royal Highness Sheikh Mohammed bin Rashid Al Maktoum, UAE Vice President and Prime Minister and ruler of Dubai. The address itself will be delivered by His Excellency Abdul Rahman bin Mohammed Al Awais, the Minister of Health and Prevention for the UAE. And Minister, I can see you, Your Excellency, over to you.
أصحاب المعالي والسعادة أيها السيدات والسادة، يسعدني أن أكون بينكم في المؤتمر العاشر بشأن تعزيز الصحة لتحقيق الرفاه والإنصاف والتنمية المستدامة.
Excellencies, ladies and gentlemen,
وأن
I
أنقل
am
لكم
pleased
تحيات
to be here
صاحب
among
الشيخ
you
محمد بن راشد آل
at the
مكتوم
10th
نائب رئيس
conference
الدولة
of
رئيس مجلس الوزراء حاتم دبي رعاه الله.
of promoting
ويسرني
prosperity, equity,
إلقاء
and
هذه
sustainable
الكلمة
development,
بالنيابة عن سموه.
and to convey to you the
كما
greetings of His
يسرني أن
Highness Sheikh
أتقدم
Mohammed
بخالص
bin Rashid
الشكر
Al Maktoum,
للدكتور تدروس
Vice
أدهانم
President
المدير العام
and
لمنظمة
Prime
الصحة
Minister of
العالمية
the
على دعوته
United
لإلقاء كلمة باسم
Arab
الإمارات
Emirates.
العربية.
I
أصحاب
am
المعالي
also
والسعادة
speaking,
أيها
of
الأخوة
course, on
والأخوات،
behalf of His
نبارك
Highness
لكم
and
حسن
on behalf of the
اختياركم
United
لجودة
Arab
الحياة
Emirates. I am so pleased
والإنصاف
to
والتنمية
extend my
المستدامة
sincere
كموضوع
thanks to
للمؤتمر
Dr.
العاشر
Tedros
لتعزيز الصحة.
Adhanom,
إن
Director
الإمارات
General of
منذ
the
اتحادها
World
قبل
Health
50
Organization
عاما
for
آمنت
his
بأن
kind
الاستثمار
invitation
في
to
الإنسان
us
يحقق
to
نتائج
speak on
كبيرة
behalf of our
وذات
country, the
قيمة
United Arab
مضافة.
Emirates.
وقد قال
Excellencies,
المغفور
ladies
له
and
بإذن
gentlemen,
الله تعالى الشيخ زايد بن سلطان آل نهيان
we
المؤسس
congratulate
الأول
you
لاتحاد
for the
الإمارات
excellent
إن بناء
choice of
الإنسان
this
هو بناء
topic
صعب
of this
لكنه
conference
هو الثروة الحقيقية.
about health
كانت
promotion.
وما زالت هذه المقولة منهجنا الذي تبنيناه في إكمال مسيرة ورؤية مؤسس الوطن طيب الله ثراه لبناء دولة تنعم بالرفاه والتنمية المستدامة. رغم أن رؤيتنا كانت حلما بعيد المنال، إلا أننا تمكنا بفضل الله تعالى ثم عملنا الجماعي من اجتياز الكثير من التحديات والصعاب، لأننا راهنا على الإنسان ونحن واثقون أن الرؤية وحدها لا تكفي، إنما الرهان الحقيقي لنمو الأوطان يكمن في تطوير الخطط والمقاييس وإدارتها من خلال الإنسان لتحقيق أفضل النتائج. السيدات والسادة، على الرغم من حداثة اتحاد الإمارات وصغر مساحتها نسبيا، إلا أننا أثبتنا أن الدول لا تقاس بهذه المعايير، حيث أننا رسخنا إنجازات دولتنا بكل فخر، بل وأصبحنا من الدول التي تصيغ المعايير والمقاييس لازدهار الأوطان. وهذا ما تمثل في مشاركة الإمارات في تدشين أهداف التنمية المستدامة 2030 بالتعاون مع الأمم المتحدة بقيادة سمو الشيخ عبد الله بن زايد آل نهيان وزير الخارجية والتعاون الدولي. فقد شغلت الدولة مقعدا يمثل منطقة آسيا والمحيط الهادي والمجموعات العربية أيضا. كما كان لنا دورا مهما بالمساهمة في قضايا مثل الطاقة والتعليم والشراكة العالمية والصحة والمياه وتمكين المرأة، مما نتج عنه رسم خارطة طريق واضحة بأهداف التنمية المستدامة ومؤشراتها ومحاورها لجميع دول العالم والتي ترتكز على مبادئ المساواة. كنا من أوائل الدول التي تبنت وأسسها، وعلى إثرها قمنا بتشكيل لجنة وطنية عليا متعددة القطاعات من جميع الوزارات والجهات المعنية، والتي قامت بدمج أهداف التنمية المستدامة من جميع أعمال الوزارات من خلال رؤية الإمارات 2021، والتي بنيت أجندتها على أساس الصحة والتعليم والعدل والمساواة والبيئة والابتكار. السيدات والسادة، إننا نمضي الآن أكثر من أي وقت مضى في تحقيق ما خططنا إليه، ونتطلع بشغف إلى المستقبل. فاعتمدنا الاستراتيجية الوطنية لجودة الحياة 2031 للانتقال بالإمارات من مفهوم الحياة الجيدة إلى المفهوم الشامل لجودة الحياة المتكاملة، للنهوض بجودة حياة الإنسان من جميع نواحي الحياة، بما فيها البعد الاقتصادي والاجتماعي والبيئي والصحي. وشكلنا مجلسا أعلى لجودة الحياة متعدد القطاعات من جميع الجهات المعنية لتنفيذ هذه الاستراتيجية، وكان لجودة الحياة الصحية ومحاورها الأربعة الحيز الأكبر من هذه الاستراتيجية، ما يساهم في دفع ودعم رؤية الإمارات 2021 ووصولا إلى تحقيق أهداف مئوية الإمارات 2071. إن العالم يمر بوضع غير مسبوق بانتشار وباء كوفيد ومتحوراته، والذي أثر بشكل مباشر وغير مباشر على جودة حياة الإنسان في جميع نواحي الحياة. إن التضامن العالمي
Okay, then, well, it seems like we got slightly cut off there from the UAE, but we thank His Excellency for those opening remarks and very much appreciate his support for this conference going forward. We now hear, though, from the Honourable Grant Robertson, Deputy Prime Minister of New Zealand.
Kia ora, and greetings to all the participants at this WHO Global Conference on Health Promotion. It's really exciting to hear that the theme of the conference is well-being, which has been a guiding principle of the work of our government. I also welcome the Geneva Charter for Wellbeing, which I understand the WHO will issue at the close of the conference. We share the goal of equitable health and social outcomes within ecological limits. To progress towards this, our government has focused on embedding a wellbeing approach into the way policy is developed in Aotearoa, New Zealand. For me, wellbeing means people being able to lead fulfilling lives which have purpose and meaning for them. A government does not determine a person's well-being, but we can certainly play a part in enhancing it. Our government sees three broad elements for policy decision-making to better support well-being. Firstly, it's about moving beyond narrow measures of progress like GDP to consider the wide range of factors that matter to well-being. Secondly, it's about looking at intergenerational outcomes to ensure our well-being is sustainable for future generations. And last but not least, it's about taking a whole-of-government approach, recognising that we have to work across agency and departmental boundaries and work with partners outside of government. It's the only way we're going to tackle the systemic challenges that constrain well-being. The New Zealand Government has drawn on the New Zealand Treasury's Living Standards Framework, or LSF, to support our wellbeing approach and consider the broader impacts of policy in a systematic and evidence-based way. The LSF continues to evolve, with a new version released in October that strengthens our consideration of children and of culture, including Te Ao Māori and Pacific perspectives. We have increasingly been using Heara Waiora, a framework that represents a Māori Indigenous perspective on wellbeing. Our government utilises many other frameworks and indicators to inform our wellbeing approach. One other example is Statistics New Zealand Ngā Tūtohu o Aotearoa. It aims to provide a comprehensive suite of social, cultural, environmental and economic indicators that provide an independent and transparent picture of wellbeing in New Zealand. Our government has been doing a number of things to put wellbeing at the heart of policy making. One of the things you may be aware of is the work we have done to embed wellbeing into our budget process. We've done this at every stage of the budget, from setting priorities to using a wellbeing analysis to assess potential budget initiatives, and then to making the inevitable trade-offs that come with the privilege of being in government and putting a budget together. But it's not just about the budget. We've also sought to embed a wellbeing approach across the public sector through a range of avenues. These have included new reporting requirements. We've introduced new legislative requirements for the government to report annually on its wellbeing objectives via the budget, and for the Treasury to periodically report on the state of wellbeing in New Zealand. The Child Poverty Reduction Act, which we passed in 2018, also requires the government to report each budget on a set of child poverty measures. We've also encouraged agencies to strengthen wellbeing analysis within broader policy processes, such as in agency and strategic planning processes and business case analysis. The Treasury is now considering ways to incorporate this into the regulatory impact analysis process, beginning with climate implications of policy assessments. Our broader state sector reform aims to enable and reinforce more collaboration across the public sector and support public sector agencies to focus on collective outcomes rather than individual agency outcomes. One example is joint ventures, which we've created where multiple agencies can effectively collaborate on complex problems and then be collectively responsible for improving outcomes. New Zealand's approach to COVID-19 was a strong public health response, which was also, in our view, the best economic response. We've invested to protect our people, with a focus on protecting employment, recognising the evidence that unemployment has one of the strongest relationships to self-reported well-being. We recognise that the impacts of COVID-19 have been uneven, and our government is committed to supporting a strong, sustainable, balanced and inclusive recovery. This, and all the work that I don't have time to mention, reflects our government's commitment to the well-being of New Zealanders and a recognition that people value more than just material prosperity. I know many countries share these objectives and are also taking ambitious steps to improve the well-being of their people and the global community. We are all pushing forward in different ways to build our understanding of what matters for well-being and to use that to drive policy. The value of conferences such as this one is the opportunity to learn from diverse experiences. I wish you all the best for the rest of the conference and success to each of you in your contributions to the aspirations of the WHO's new charter to create well-being societies in your own country. Ngā mihi nui kia koutou katoa. Farewell from New Zealand.
Deputy Prime Minister, thank you very much indeed. Now, Matthias Cormann is Secretary General of the OECD, the Organisation for Economic Cooperation and Development, and this is his message.
Dear Director General, dear Tedros, Excellencies, Ministers, distinguished guests, thank you for inviting me to address the World Health Organization's 10th Global Conference on the timely topic of promoting health for well-being, equity and sustainable development. The COVID-19 pandemic continues to have far-reaching consequences impacting on people's lives and livelihoods everywhere. To date, more than 5 million people have sadly and tragically lost their lives since the beginning of the pandemic. Children have spent long periods out of school, negatively affecting their human capital, and unemployment has risen. OECD research shows that 1 in 3 people reported at least one financial difficulty related directly to the pandemic since COVID first hit, and 1 in 4 were at risk of depression or anxiety by early 2021. There's never been a better time to commit to improving the health and well-being of all populations on which our societies and economies depend on. Our work on measuring distance to Sustainable Development Goal targets, and particularly the 2019 edition, showed that progress towards health-related targets is slow across OECD countries and even moving in the wrong direction in some countries, when it comes, for example, to obesity or tobacco consumption, factors that are gaining more significance in the COVID-19 context. Our work on public health shows the critical importance of investment in health promotion and prevention. Labour market costs of poor mental health exceed 1.5% of GDP across European countries. Yet less than 3% of total health spending goes to disease prevention and promotion across those same OECD countries. A comprehensive policy package to promote an active lifestyle would generate $1.7 in economic benefits for every dollar invested. But investing in health policies alone is not enough. Since the launch of the OECD Better Life initiative in 2011, we have been building a more comprehensive picture of people's well-being based on more than 80 internationally comparative indicators. The OECD well-being framework, which lies at the core of this initiative, shows that strengthening safety, housing, and the environment is important for physical and mental health. Our work also brings public health and well-being closer together. We assess public health policies not just on the basis of physical health and economic outcomes, but also based on the impact these policies have on a range of other well-being dimensions, including subjective well-being, income, jobs, education, and social relationships. This approach is what we call the economy of well-being. It is defined as a capacity to create a virtuous circle in which the well-being of citizens drives economic prosperity, stability, and resilience, and good macroeconomic outcomes allows to sustain well-being investments over time. Along with education, gender equality, and social protection, health is a key driver in this approach. This approach looks at the range of services covered by primary healthcare and addresses new or persistent risk factors. Reducing inequalities of access is also essential to promote better health outcomes, as the proportion of people in poor health weighs heavily on key health indicators. Moreover, health inequalities are often divided along economic, educational, or occupational lines. Unmet care needs are substantially higher for low-income people and the most vulnerable groups, for example. The interlinked health, social, and economic impacts of the pandemic have shown more clearly than ever that making these connections is critical for effective policy making. We hope that OECD work on health promotion and well-being can help support you in implementing the policies needed for achieving a stronger, more sustainable, and more resilient future. I wish you an excellent, positive, and productive discussion. Thank you.
Dr. Corman, thank you very much. Now, Martin Chungong is the Secretary General of the Inter-Parliamentary Union and had this message.
Dear Director General, dear Tedros, Excellencies, Ministers, distinguished guests, thank you.
The wrong video to play for you, but I do believe we now have Martin Chungong.
Ladies and gentlemen,
from Cameroon.
As the Secretary General of the Inter-Parliamentary Union, the global organization of Ladies and gentlemen, as the Secretary General of the Inter-Parliamentary Union, the global organization of national parliaments, it's a great pleasure to address you in this important session on health promotion in times of complexity and uncertainty. I wish to thank our long-standing partner, the World Health Organization, for inviting me and for recognizing the crucial role parliaments play in enhancing individual and collective well-being. I would like to focus on one factor that lies at the heart of Parliament's work: legislation. Laws are powerful instruments that can protect the right to health, ensure equitable access to healthcare services, and strengthen the governance of the health sector. However, laws can also create barriers and discriminate. The notion of legal determinants of health has emerged to recognize that laws in themselves can have a significant impact on health and well-being and help us realize the promise of the Sustainable Development Goals. This is why the IPU works closely with parliaments at the national level to support them in becoming agents of change. For example, with IPU support in 2016, the Parliament of Rwanda passed a reproductive health law that recognizes the right to access reproductive health and family planning services. Last year, the Parliament also revised legislation to enable civil registration at health facilities. This is an important change that allows individuals to have a legal identity and thus access vital services. Following further capacity building, parliamentarians identified legal provisions restricting access to health for adolescents and are now promoting an initiative to address these gaps. We can see from this example that investing in parliament pays off, but sustained efforts and commitment are needed. Allow me to highlight two major challenges for using the full potential of legislation to advance health. First of all, the current COVID-19 pandemic has led countries to resort to emergency measures, which may be subject to only limited parliamentary scrutiny. As part of our work on universal health coverage, parliaments have also reported decreased momentum on legislation on other health priorities beyond COVID-19. However, the role of parliaments has never been so important. Lessons from the COVID-19 response must be learned to identify new barriers to access to health and inequitable health outcomes. At the same time, where improvements were made, they should become long-term and be backed by necessary legislation. We are encouraged to see that parliaments are taking steps to review their country's COVID-19 response, including from the perspective of human rights and vulnerable and marginalized communities. The second challenge is the need for a change in mindsets. Well-being should be at the center of legislation in all sectors. In 2019, IPU member parliaments adopted a landmark resolution on universal health coverage. We're following up on its implementation and are pleased to be able to count on WHO expertise to help parliaments deal with this complex agenda. We share the conviction that universal health coverage should be at the center of COVID-19 response and recovery plans and should be part of social reform programs to address poverty and inequalities. At the same time, our well-being is highly dependent on the planet we live in and its resources. There is an urgent need for a socially inclusive COVID-19 recovery that is in line with climate action and environmental protection. The IPU and the United Nations Environment Programme have published a guidance note presenting a number of approaches for a green recovery. Parliaments can, for example, enact legislation that mainstreams sustainable consumption and production into all COVID-19 recovery efforts, and that contributes to renewable energy policies. They can incentivize green investment and the creation of green jobs. They can further improve environmental conditions and the health and quality of life of the people by ensuring COVID-19 legislation includes safeguards for environmental rights. As you can see, the challenges are manifold and action is needed on many fronts, but we'll continue to walk the talk by working with parliaments, WHO and other partners to promote enabling legal environments for improved health and well-being for all. I thank you for your attention.
Martin Chungong, thank you very much. Now, earlier we tried to cross over to the Kingdom of Bhutan and we could see them, but we couldn't quite hear them. So I believe we can now cross to hear from Her Excellency Dasho Deshan Wangmo, who's the Health Minister of Bhutan, who is speaking on behalf of His Excellency, the Prime Minister of the Kingdom of Bhutan. Bhutan, I hope we can see and hear you.
Thank you, Hannah. Am I audible now?
Yes, we can hear you clearly.
Okay, perfect. Thank you. Excellencies, distinguished speakers, participants, ladies and gentlemen, it gives me an immense pleasure to participate in the 10th Global Conference on Health Promotion on behalf of my Prime Minister. I wish to convey the greetings, warm greetings of His Majesty, the King, Her Majesty, the Queen, and the Royal Government of Bhutan. I would like to thank the WHO for invitation to Bhutan to deliver for the opening session of the Global Conference on Health Promotion and Well-being, and for initiating the platform for scaling up health promotion effort across the globe. Today, we endure the devastating COVID-19 pandemic, we continue to experience tremendous pressure on our health system. In countries exacerbated by economic hardship, social and political unrest, health and well-being of millions of people across the world are complex. I would like to take a moment to offer our sincere prayer for the life lost to this pandemic and share our deepest solidarity with every member state as we continue to fight the COVID pandemic. While we face these grim challenges, we are also mindful of the opportunity that is presented by this pandemic. Health has never been higher on the political agenda as leaders around the world unanimously share the belief that health is the heartbeat of the developmental agenda and that there is a greater need to invest in health sector for the well-being of humanity and our planet. As we gather today virtually for the 10th Global Conference on Health Promotion, we are once again presented with an opportunity to take stock of our past achievements, learnings, limitations, and to collectively chart a way forward for health promotion, a core fundamental component of public policies and programs for pursuit of equity, justice, and health for all. In Bhutan, we continue to be guided by our overarching philosophy of health in all and health for all. There isn't more appropriate time to reflect on this important rate of health promotion that during the current pandemic, which has now consumed 5.3 million lives across the world. Looking back, the first international conference on health promotion, which was in Ottawa in 1986, that was primarily a response to growing expectation of a new public health movement around the world that continues to persist to this day. Since then, the WHO Global Health Promotion Conference have helped establish new benchmarks and chart greater vision and principle to spark appropriate actions for strengthening health promotion efforts globally. The last global conference that was held in Shanghai in 2016 highlighted the critical link between promoting health and the 2030 Agenda for Sustainable Development. On a personal note, I strongly feel that universal health coverage is at the core of health promotion, and we must strive to achieve UHC through a whole of a government and whole of a society approach. For Bhutan, UHC means caring for people, and especially vulnerable with lifelong health conditions. UHC to us is equity, justice, and well-being of humanity. Health promotion has a deeper and more significant role in accelerating the global progress towards achieving the 2030 goal as one of the prerequisites to make any progress towards the sustainable development goal is to induce healthy behavior change at all perceivable level. Today, Bhutan is privileged to be part of the 10th Global Conference on Health Promotion, where well-being is the theme of the conference. Apart from reinforcing ongoing public health efforts in combating COVID pandemic, I'm hopeful that this conference will also lay the much needed foundation and global consensus in reimagining and shaping a post-COVID world. The pandemic has taught us great lessons, and it is now apparent to the global public health community that what we are all doing is not adequate, and we must significantly strengthen our collective effort to achieve desired public health results, particularly during public health emergencies and pandemics. There is also the urgent need to constantly update and leverage on the changing technology landscape and the use of social and popular media to induce positive behavioral change and to fight miscommunication. We must leverage the political momentum generated by the pandemic today to harness the positive impact of health promotion for designing a sustainable health promotion system for a healthy planet tomorrow. Lastly, Bhutan reaffirms our commitment towards health for all and health in all. Health promotion is a shared responsibility of each and every one of us, and we must continue to work together for a resilient, healthy, and an inclusive planet for tomorrow. Tashi Dele, and I thank you for your attention.
Bhutan, thank you so much as well. I'm so thrilled that we could re-establish that connection to you, to hear from you as well. Now, as you can see, Dr. Tedros has been listening intently to all of those addresses and still joins me here in the studio. Tedros, it's so great to hear the support that is there for health promotion and for well-being in this conference going forward. And I know that before we let you go, there is one particular individual whose efforts you would wish to recognize.
Exactly, that's true, Hannah. And with such a great pleasure, actually. My sister Ilona, you don't need an introduction, as everybody working on global health knows you very, very well. You were the mastermind behind the Ottawa Charter, and you have contributed significantly to the further development of health promotion over the last decades. But your influence goes far beyond health promotion. You remain actively engaged in almost every area of global health. You have contributed to universal health coverage, epidemic preparedness, non-communicable diseases, the economics of health for all, women for global health, just to name but a few. I can take a lot of time, actually, if I list everything. A long list. It's frankly impossible to imagine any serious discussion about global health without you, Ilona. I especially look forward to working with you on the joint World Health Summit next year. So thank you for everything you are and everything you continue to do for global health. It therefore gives me a great pleasure to present you with this WHO medal in honor of your service to global health.
Thank you very, very much. How wonderful this is. Thank you. I'm deeply honored. Thank you very much.
And Ilona, I know we will be hearing more from you as well through the course of the
And that's the certificate that goes with that.
Thank you.
Thank you.
So huge congratulations to you, Ilona.
Thank you.
My thanks also go to, of course, to Dr. Tedros for being with us for the start of our conference. Let me introduce you now to the virtual platform, which, quite frankly, if you've managed to hear everything that we've been saying so far, means you've successfully made your way in. So congratulations to you. But essentially, it's quite easy, I'm told at least, to navigate your way around the plenary sessions which are coming up, the forum, which, as I said, has already started, deep dives as well. But a good rule of thumb to follow then is go to Agenda, and there you will see the schedule of events. Access to all the sessions is through the agenda, and I believe you can click on Join Live, which is to the right of your screen, when you would like to join the session. And you do need to actually click on Join Live to join the session. You won't automatically just be enrolled into it. All the plenaries will have interpretation into the 6 UN languages, so French, Spanish, Chinese, Russian, Arabic, and of course English. And also please do follow the conference on social media as well. You can use the hashtag health promotion and also the hashtag wellbeing as well. And a final reminder of the poll, the results of which will be coming up in the first plenary. You do still have time to vote and give us your thoughts. A reminder of the question, do you think it's realistic to create wellbeing societies, or is this just wishful thinking? Tedros, I'm sure, thinks it's realistic. Definitely realistic. So join us very shortly then for the first plenary. I look forward to seeing you then.